Hyperaesthetic surgery is one which produces a facial aesthetic result that exceeds the sum of its individual parts. So if I'm looking at somebody, they may want their ears pinned back through an otoplasty or their earlobe shortened. They may want a rotational endoscopic brow lift to give them more glamorous eyebrow. Would I want to also at the same time make their eyes more almond-shaped, more sensual, more exotic? Do we want to combine that with a rhinoplasty or a revision rhinoplasty for that matter? Do they need their breathing help? Do they need a 3D facial fat transfer into the brow to fix an apex deformity, or into the dark circles of the tear troughs, or into the palpebral malar grooves, nasolabial folds, or around the jawline or chin for that matter? Is the skin loose? Do they need a deep plane facelift or Weissmass facelift for that matter? Do they need an endoscopic mid facelift? Lip reshaping surgery, 3D upper lip lift, or a medialized corner lip lift, traditional corner lip lift, or DAO release, or, while we're on the subject of lips, a lower VY plasty to raise the lower lip to help hide the lower teeth and pout it out in the middle third. All of these have to be taken into account. Oh, maybe the patient would aesthetically benefit from malar cheek implants. Did you know that, Bugsy? Or are you too tired? Do they need mandibular angle implants? Perhaps a piriform aperture implant while you're at it? Or a chin implant? Do they need a chin implant that's a small, extra small, medium, large, extra large? Does it need to be vertically lengthened to give their chin more length? The AP, the anterior posterior viewpoint. Does the chin need to be positioned in such a way that it just gives you pure projection? Or do we need to angle it to change the actual height of it? For that matter, too, we're right on the subject of the neck, whereupon we can actually treat those pesky platysmal bands, perhaps the necklace lines, and fill those up. And maybe while we're at it, doing a neck lift combined with a lower facelift, where the incision is confined into the ear, around the ear, and behind it. So all of these factors come into play with hyperaesthetic plastic surgery. Dealing with this niche field, the hyperaesthetic surgeon needs to know all of these procedures intimately to come up with a surgical plan thought out carefully and executed precisely in order to fulfill the patient's goals. And so the results can be quite astounding. Hyperaesthetic surgery is very similar to the conductor of a symphonic orchestra. The conductor has to have a better, more intimate, profound knowledge of the instrument more than the individual musician that is playing that instrument, whether it be an oboe, a cello, a piano, a flugelhorn. And there you have it. Bugsy says good night and have happy holiday.